Today, we will demonstrate how to use the Bahmni EMR developed by the Nepal Innovation Center. This is an informational video to guide your clinical practice. First, open your web browser and type the local server address provided to your department in the address bar to access the EMR. Next, click on Clinical. You will be directed to the login screen. Enter your username and password to continue. From this home screen, select the clinical icon again to enter the provider dashboard. You will now see a list of all patients scheduled for today. Active patients includes all patients registered or seen within the past 24 hours. Emergency patients lists those who have visited the ER today. No disposition refers to patients currently under your consultation whose records have not yet been finalized or closed. My Patients displays a complete list of all patients you have treated today. Admitted shows all patients currently staying in the indoor wards. All provides access to the historical records of everyone who has previously visited the hospital. To find a specific person, type the patient's name or ID code in the search box. Tip: type the last 3 digits of the ID for faster access. Once you click on a patient ID, you will be directed to the dashboard, which displays their previous medical history and past consultations. For today's demo, we will click on Consultations. You will then be forwarded to the OPD visit form. We will now proceed with how to correctly fill out this form. Please ensure you fill in the details exactly as provided on the patient's physical ticket. Under Chief Complaint, record the primary reason that brought the patient to the hospital. In the History of Present Illness, HPI, describe the condition in detail. In an OPD setting, focus on the most clinically relevant information. Document any past medical history the patient may have. You only need to fill in the fields that are relevant to the patient. Not every box requires an entry if it isn't necessary for the case. Review of systems. Summarize your clinical findings and physical observations here. Use systemic examination for a more detailed physical exam. For standard OPD patients, you may skip this and include your notes in the ROS section instead. You also have the option to upload photos of OPD cards, lab reports, or specific lesions if required. Record your differential diagnosis here for future reference and follow-up notes. Important: always click Save on every page before proceeding to the next section to avoid losing data. Specialized notes are available if needed, for example, the ANC note for pregnancy or specific vitals notes. Do not forget to fill in the vitals, as this information is crucial for safe and effective patient treatment. Use the Order panel to send requests for lab investigations. Scroll down further to locate the radiology panels for X-rays or scans. You can also use the search box within the panel to find specific tests quickly. Remember to click Save after all investigations have been ordered. Next, we will enter the diagnosis. Type the diagnosis and a drop-down panel will appear. Choose the most appropriate option. Note that the system follows the ICD-11 standard. Categorize the diagnosis as primary, the main reason for the visit, or secondary, comorbidities or previous conditions. Specify whether the diagnosis is confirmed or presumed. Enter each diagnosis individually and ensure you save after each entry. To order medications, enter the names here. Note that all medications are listed by their generic names. Follow the prompts to fill in the required dosage and frequency for each prescription. You can also order instruments or necessities for procedures. For example, for cannulation, you can order the specific cannula size, leucoplast, and syringes. Once the consultation is finished and you are ready to discharge or refer the patient, go to the disposition section. In consultation notes, provide your final advice, follow-up dates, or any difficulties encountered, example, if the patient is non-compliant or refuses admission. Then, click Save and Done. The system includes various note types intended for different hospital personnel based on their specific needs and fields. This includes the discharge note for ward transitions and the emergency note for urgent care settings. You can click the Expand More button to view the full details of any previous consultations. And we are finished. You will find that you get used to the system very quickly once you start using it. Practice makes the process much smoother and faster each time. Thank you for watching this tutorial.